Patients seeking medical care covered by the National Health Insurance will be required to present proof of ID starting today in an effort to enhance the fairness of the insurance system by preventing free riders from abusing it.
오늘부터 건강보험 급여가 적용되는 진료를 받을 때 신분증 등을 반드시 제시해야 하는 건강보험 본인확인 의무화 제도가 시행됩니다. 이는 보험 무임승차자의 제도 악용을 방지해 보험제도의 공정성을 높이기 위한 조치입니다. Tell us more.
So I did not even realize that you could receive medical care without presenting ID. I guess I took it for granted that you would definitely have to show proof of ID. But I think if you work the system and people who are keen on perhaps abusing it might have found ways to sort of either quote borrow IDs or do other things that would have obviously been examples of abusing the system.
Yeah, having been to the doctors numerous times myself, I think the general practice was to just say what your name is and then your ID number. You could just say it without showing them your actual ID card. And then they will look it up and then they'll, offer you the discounted price with the insurance that you're covered with.
Right.
But this could be misused, right?
You know what? I think if you are a person that had no intention of misusing the program or the system, then you might not have ever thought about it.
Exactly.
But now that
Nor
you
did I,
are describing what it's like to go to the doctor, you're right. I don't think I've ever been asked for proper ID.
Exactly, but now
that will all change starting today.
Exactly, if you want to be covered by insurance, you have to show your actual ID of some sort. Of course, you can do that online as well, and that's for the first time you go to a particular general practitioner or hospital or doctor. The second time you go, you won't have to, I understand, but you will have to have your physical ID with you.
And examples of proper documentation could be your resident registration card. It could also be a driver's license, and it could also be a passport.
Right.
And obviously in the case of minors, or if you are someone that wouldn't have one of these forms of ID, you can provide other forms, but those are the three main that would be most accepted.
Right. 첫 번째 얘기했던 게 주민등록증이죠. Registration, what was the word?
Resident registration card.
Resident registration card. It's a mouthful.
Yes.
주민등록증, 그다음에 이제 운전면허증, 그리고 여권 다 가능합니다. 그 외에도 이제 나를 증명할 수 있는 그런 아이디를 보여주면은 되겠습니다. 그러지 않으면은 이제 요금 폭탄을 맞을 수가 있어요.
Right.
Okay, let's have a look at the first expression. Enhance the fairness of something.
I think that's the core of this story. The whole point of this new rule change is to enhance the fairness of this healthcare system, which obviously it's paid for by many. And if you are someone that is trying to reap the benefits or advantages of it without paying your part of it, then you are trying to get something for nothing. So the whole system, the whole point is to enhance the fairness of it for everyone.
Enhancing은 무언가를 증가시킨다, 늘린다라는 말인데요. Fairness가 공정함, 공평성을 말하고 있어요. 그래서 공정성을 높이는다라는 표현이 enhancing the fairness라고 표현을 할 수 있겠고 무임승차 하면 안 되겠죠.
Right.
It's a free rider in English, right?
Definitely. A free rider, that's a case where it's a literal free rider.
Right.
Literally, you are riding for free, whether it be on the subway, the metro, if you board without paying or if you jump the turnstile, then you are a free rider in the sense of a program or a system or some kind of service that you're receiving. A free rider is somebody that's doing that, not paying, but trying to get something for free.
Yeah, exactly. You mentioned jumping the turnstile there. turnstile은 개찰구예요. 그래서 지하철역에서 이제 카드 찍지 않고 돈을 내지 않고 개찰구 뛰어넘으면 당연히 안 되죠. 이거 이제 무임승차 설명하시면서 you cannot jump the turnstile. You shouldn't do that.
Right.
But if you get on the subway without paying, you become a free rider.
Exactly.
Which is not good. You don't do that.
No. It's illegal. You shouldn't do it, and you drive
Yeah.
the prices up for everybody else who's paying properly.
Yeah. All right, well, here is the headline again. Patients seeking medical care covered by the National Health Insurance will be required to present proof of ID starting today in an effort to enhance the fairness of the insurance system by preventing free riders from abusing it.